Today's topic is IMNCI. What is IMNCI? That is Integrated Management of Neonatal and Childhood Illness. Over last 3 decades, the annual number of death among the children less than 5 years of age has decreased by almost 1/3. However, this reduction is not eventually distributed throughout the world. Every year, more than 10 million children die in developing countries before they reach their 5th birthday. 7 in 10 of these deaths are due to acute respiratory infection, diarrhea, measles, malaria, or malnutrition. Here you can see that is malnutrition contribute about 54% of death, followed by perinatal cause, that is 20%, pneumonia 19%, diarrhea 15%, measles 8%, malaria 7%, and other 28%. Projection based on 1996 analysis indicate that the common childhood illness will contribute to be a major contributor of child death through the year 2020 unless some greater effort be made to control them. And this assumption make a strong case for introducing new strategies which significantly reduce the child mortality and improves the child health and development. Infant and childhood mortality are very sensitive indicators of inequity and poverty. And it is of no surprise to see that the children who are most commonly and severely ill belongs to the vulnerable and underprivileged population of low-income countries. So improvement in child health are not necessarily depend on use of any kind of sophisticated or expensive technologies. So what it required? It required an integrated evidence-based syndromatic approach of case management. So there are two terms. One is integrated, another is evidence-based management. So integration has different meanings at different level. At the patient level, it means case management. At the point of delivery, it means multiple interventions provided through one delivery channel, like vitamin A supplementation given to the children. And at system level, integration means bringing together the management and support function of different sub-programs and ensuring complementarity between different levels of care. Now, what is syndromatic approach? Syndromatic approach supports the rational, effective, and affordable use of drugs. An integrated approach is needed to manage the sick children to achieve better outcome. And children health program need to move beyond tackling single disease in order to address the overall health and well-being of the children. Because we know that most of the sick children are presented with various signs and symptoms which are related to more than one condition. And this overlap means that a single diagnosis may not be possible or appropriate. And treatment is also very much complicated and need to combine therapy for several conditions. During mid-90s, the WHO in collaboration with UNICEF has first developed a strategy that is known as integrated management of childhood illness, where the end component is missing. So IMCI strategy include curative care, aspect of nutrition, immunization, disease prevention, and health promotion. The objectives of IMCI is to reduce the death of under 5 children, then frequency and severity of illness, disability, and to improve the growth and development. But later on, this strategy has been expanded in India to include the neonates, and this strategy was renamed as Integrated Management of Neonatal and childhood illness. So what are the goals of IMNCI? That is the management of sick children and sick infant, nutritional assessment and counseling of all sick infant and children's, focus on most common cause of mortality, and home-based care. Essential component of IMNCI, that is to improve the health and nutritional worker skill, to improve the health system, and to improve the family and community practices. Now, IMNCI is broadly classified into two categories. That is the young infant up to 2 months of age, as they are very much susceptible to various kinds of infection and diseases, and the children from 2 months to 5 years. So whenever a child or infant comes to the outpatient facility, the first thing you have to do is the assessment, followed by classification and identification of treatment and referral treatment or counseling of the child caretaker, followed by follow-up. And in referral health facility, you have to do emergency triage assessment and treatment, and diagnosis, treatment, and monitoring of patient progress. Then at home management, you have to teach the mother how to give oral drug, how to treat local infection at home, then counseling of the mother about the food, especially if the child is in exclusive breastfeeding period, then feeding recommendation, feeding problem, fluids, when to return to the health facility, and also about the mother's own health. Now, young infant up to 2 months of age. In this topic, I will be discussing only the young infant up to 2 months of age. So whenever a young infant up to 2 months of age visit to the outpatient facility, the first and foremost thing we have to check is for any possible bacterial infection or jaundice. Next, we have to assess for the diarrhea. After then, we have to check for the feeding problem, malnutrition, and immunization status. Then check for other problem and classify the condition according to the color-coded chart. So there are 3 colors, that is pink classification, where the child cannot be managed at home and it definitely required hospital admission and we have to refer the child. Then yellow classification, that means child need a specific treatment which can be given at home, that is antibiotic or ORS. And last is the green classification, means child do not need any medicine and just give home care is sufficient for the child. So first is check for possible bacterial infection and jaundice. Whenever a young sick infant comes to you, first the infant should be calm and asleep, and you have to assess for first 5 signs. What are those first 5 signs? That is, you have to count the breathing, look for the chest indrawing, then look for grunting, nasal flaring, and bulging fontanelles. Next, you have to check for the skin of the infant. That is, any kind of red spot or blister is present or not. Presence of 10 or more skin pustules indicate a bacterial infection. Then look whether umbilicus is red or draining pus. Then look whether the palm and sole of the infant is yellow or not. That is, whether the jaundice is physiological jaundice or it is a pathological jaundice. Then measure the temperature of the infant and see if the young infant is alert, lethargic, or unconscious. So possible serious bacterial infection, that is presence of any one of those 5 signs. If any one sign is present, that means the infant is having a serious bacterial infection. Or if skin pustule more than 10, or if there is a convulsion or high fever, that all indicates that the infant is having a serious possible bacterial infection. And give first dose of intramuscular ampicillin and gentamicin. Treat to prevent low blood sugar. Warm the young infant by skin to skin contact. Advise the mother to keep the infant warm on the way to the hospital and referred urgently to the hospital. Next is local bacterial infection. That is, the infant is alert, umbilicus is red or draining pus or skin pustule less than 10. Here we have to give oral antibiotic, that is cotrimoxazole or amoxicillin for 5 days. Teach the mother how to treat that umbilical infection with Gentin violet and follow up in 2 days. Then severe jaundice, that is pathological jaundice where the palm and sole are yellow, age less than 24 hours or 14 days or more. In that case, treat to prevent low blood sugar. Warm the young infant by skin to skin contact. Advise the mother to keep the young infant warm on the way to the hospital and referred urgently to the hospital. And if it is a physiological jaundice, that is palm and sole are not yellow, then definitely it can be managed at home. Just advise mother to give home care for the young infant. Advise mother when to return immediately and follow up in 2 days. Now coming to the assessment of diarrhea. How to assess diarrhea? First question is, ask for how long, whether it is less than 14 days or more than 14 days. If it is less than 14 days, then it is acute diarrhea. If it is more than 14 days, it is a chronic diarrhea. Then there is blood in the stool to differentiate whether it is a diarrhea or dysentery. Then look at the infant general condition, that is whether the infant is lethargic or unconscious or irritable. Why? To assess the dehydration status of the infant, whether infant is having some dehydration or severe dehydration or no dehydration. Also look for sunken eye and skin pinch, whether goes very slowly or slowly. Now, if it is severe dehydration, that is the infant is lethargic or unconscious, sunken eye, not able to drink or drinking poorly, and skin pinch goes back very slowly. In that case, first look whether the infant has low weight or other severe classification. Then give first dose of intramuscular ampicillin and gentamicin. And if infant do not have low weight or any other severe classification, then just start for severe dehydration, that is plant C. Means you have to give 100 ml per kg of ringer lactate, that is 30 ml per kg in first 1 hour and 70 ml per kg in next 5 hours. Then reassess the child every 1 to 2 hours whether the child is improving or not. If not improving, then give IV drip and also give ORS of 5 ml per kg per hour as soon as the child is able to drink. Then refer urgently to the hospital. Advise mother to continue breastfeeding and advise mother to keep the infant warm on the way to the hospital. Next is some dehydration, that is the infant is very restless or irritable, sunken eye, drink eagerly, very thirsty, and skin pinch goes back slowly. Here also see whether the infant have low weight or another severe classification. Then give first dose of intramuscular ampicillin and gentamicin and referred urgently to the hospital. Advise mother to continue breastfeeding and advise mother to keep the infant warm on the way to the hospital. But if the infant do not have low weight, then start plan B for some dehydration. That is, you have to give 200 to 450 ml of ORS during first 4 hours and ask the mother to give frequent sip of ORS from a cup. And if the child vomit, then wait for 10 minutes and Then continue more slowly. Continue breastfeeding whenever the child wants, and follow up in 2 days. Then no dehydration, that is not enough sign to classify some or severe. It is no dehydration. Here we have to start plan A. In plan A, just give extra fluid, teach the mother how to prepare ORS at home, and continue the feeding, and ask the mother when to return, and follow up in 5 days if not improving. Then severe persistent diarrhea is definitely very, very dangerous for infant up to 2 months of age, as there are high chances of malnutrition. So it is under pink classification. And again, the protocol is same, that is give first dose of intramuscular ampicillin and gentamicin. And if the infant has low weight or dehydration or any other severe classification, then treat to prevent low blood sugar. Advise the mother to keep the infant on the warm on the way to the hospital, and refer to the hospital. Severe dysentery, here also it is in the pink classification. Give first dose of intramuscular ampicillin and gentamicin, and treat to prevent low blood sugar. Advise the mother to keep the infant warm on the way to the hospital, and refer to the hospital. Next is check for the feeding problem. Ask whether the infant is able to breastfeed or not. As it is up to 2 months of age, then definitely the infant is in exclusive breastfeeding period. In that case, you have to ask whether the infant is breastfeeding. If yes, how many times in 24 hours? It should be at least 8 times in 24 hours. Does the infant receive any other food or drink? If yes, if mother is saying yes, then you should say that only and only breast milk should be given. Then look for the weight of the infant. Ask the mother to then assess the breastfeeding, where you have to ask the mother to put her into the breast and observe the breastfeeding for 4 minutes. What are the things we will check? That is, check if infant is able to attach. That is the sign of good attachment. That chin touching the breast, mouth should be wide open, lower lip turn outward, areola visible more in above than below the mouth. And also check for correct positioning. That is, infant head and body is in line, and infant should be well supported, very close to the mother body. Then look whether the infant have blocked nose. Look for the ulcer, white patch in the mouth. Does the mother have any kind of pain while breastfeeding? That is, flat or inverted nipple or breast abscess. All these things you have to look for. So not able to breastfeed, no attachment, no, not sucking, very low weight for age, there is possible serious bacterial infection, and you have to give in ampicillin and gentamicin IM, prevent low blood sugar, keep the infant warm on the way to the hospital, and refer urgently. Not well attached, not sucking efficiently, less than 8 times breastfeeding in 24 hours, receiving other food or drink, low weight for age, breast or nipple problem. All this, if any of the problem is there, then teach the correct positioning and attachment to the mother, increase the frequency of breastfeeding, and treat the thrush and breast problem. Counsel about breastfeeding, reduce the other food, keep the infant warm, and advise when to return immediately. Not low weight for age, no other sign of inadequate feeding, means no feeding problem, then just give home care. Praise the mother for feeding well. So follow up for breastfeeding problem is after 2 days. You have to ask the mother to visit to the OPD. And if there is no wait, then follow-up should be after 30 days. And last, you have to check the immunization status of the infant, whether BCG, OPV, hepatitis B, all those vaccines have been given to the infant or not. With this, I ended my session. Thank you.